Hello and welcome to Children's Scar Prevention and Treatments. Today we're going to talk about a few of the common questions when it comes to scars and treatment and prevention, such as what are scars, how do we prevent them, and how do we treat them. So we'll start off with what are scars. Scars are a result of when the body repairs wounds caused by surgeries, cuts, burns, or diseases. They're a natural result of the body's healing process. Any scar can be symptomatic. It means it can cause the child to have physical, psychological, and social impairments and can impair their quality of life. The longer it takes for a wound to heal from one of these things can really make it more noticeable on the skin, either by color or by texture of the skin. But you should always have wounds checked by a medical provider if they impair the movement of the joints, they cause any blistering, or look deep, especially if electrical burns and many other causes. You want to keep them checked out if you're worried about a wound or a scar. So why do scars form? All skin wounds result in some type of scarring. Some scars are only a discoloration of the skin, so it looks a little different. The pigmentation's a little off from other parts of the skin. And eventually those can kind of wear away. Mature scars can be a little more visible, especially if they're raised or indented, and can be really cause a large discoloration and can be very obvious on depending on the depth of the scar and of course the length of the time of the injury. The body's response to injury is a natural healing process, which is different stages that create this scar tissue, which we'll discuss in just a moment. The stages of healing include inflammation, proliferation, and remodeling. So let's go into those in a little more detail. Inflammation is when the body tries to heal the skin. So within the first 2 weeks of injury, the skin's like red, it's tender, it's swollen, really don't want to touch it, it looks awful, because it's just that first little time. After about 6 weeks, so those 2 weeks are over with, up to about 6 weeks, the body is in that proliferation phase where it's doing more repair by depositing scar tissue. So this collagen scab, it's discolored, it's raised, it's dry. So this is where we want to also still continue to make sure that it gets enough moisture to kind of help it out and try to get rid of those raised, red, bumpy, rigid scabs. You don't want to peel them off or anything like that, but you want to try to give them some moisture to relieve some of that issue. When you get to the remodeling phase, a lot of that coloration in the scab disappears, it kind of falls off, and you're left with this discoloration, and it softens and flattens as long as it stays moisturized, and can last anywhere from 12 to 18 months. So how do we prevent scars? So in most forms of treatment we have, and especially prevention, there's 3 types of prevention: primary, secondary, and tertiary. So in primary prevention, you basically protect the skin from damage in the first place. So using sunscreen, hot mitts, safe play practices, making sure your kid isn't left home alone to make hot items. So sometimes a lot of our injuries end up being kids pulling hot soup out of the microwave or hot tea off the counter. So just keeping a soft eye on everyone, making sure we're protecting their skin, especially young children. Secondary prevention is identifying the trauma type and the severity of the possible damage to the skin, and then treating that damage. So trying to find out how bad it is and make the damage stop, and go towards the treatment area, which is your tertiary prevention. And you want to treat the injury further and encourage the healing process to reduce the healing time. So you want to start putting on ointments, creams, and all the other things we're going to talk about in just a few minutes. So how do we treat scars? We start on this kind of ladder of progression, and it varies depending on the type of injury and severity, and where it's located and things of that nature. So we use sterile dressings, antibiotic ointments, of course, to make sure we don't have any infections, silver infused foams, ointments, and dressings. which are very helpful for antimicrobial as well. Lotion scar massage, which we're going to go into detail about and give you a better idea of what that means. And then surgical or laser repair of skin tissue if needed. So if it gets to the point where it needs a little extra past these other treatments, we might turn to that surgical repair, which we'll talk about. So you may or may not have heard of some of these ointments and treatments here, but there's two in particular that I want to focus on when it comes to ointments to treat wounds, and that's the Zilversorb gel, which is a silver infused, and it aids in wound healing and acts as an antimicrobial to reduce infection. So you want to make sure that goes directly on the wound bed and is covered to keep it there to help keep it from getting infected. Bacitracin is another way of doing this, and it's another antimicrobial ointment, but it also helps moisten the wound bed and reduces the chance of infection. Another type of antimicrobial agent that is not an ointment are these dressings, known as they're silver infused dressings. So there's two in particular, again, that I'm going to look at, and that's the Aquacel AG, or Aquacel with infused silver, and Mepilex AG, which is also infused with silver. It cannot get past how much the silver infused really helps with keeping those infections at bay. So the first one, the Aquacel AG, is more like a felt kind of feel to it. It really looks like just a piece of fabric, but you're going to cut it to the size of the wound and just set it on top of it. No extra ointments or creams most of the time. It pulls a lot of the stuff from the wound bed and just kind of gets all that gunk, and it'll get really soaked and gross after a while. But you can usually leave it on there for a few days. You want to wrap that with something, and we'll discuss what the wraps are so that it stays on for that time. Now the Mepilex AG, however, has kind of an adhesive back which holds to the skin around the wound bed. It is helpful in that matter. And it does all of the same things that the Aquacel AG does. It just holds on a little better. And it's more like a spongy foam than a felt-like fabric. So here comes the more simpler part, the wraps. So Kerlix or gauze bandage, you can find at any pharmacy. You can just wrap this around either the ointment covered skin or the silver dressing in a covered skin, or even the Silvasorb. You can wrap this around just to keep it there clean, intact, and make sure that nothing else is getting into it. And then to make sure that stays on, because nobody really wants to use that tape, regular tape, medical tape. It doesn't stick very well, and then you still have all the gauze exposed that gets dirty and kind of gross. There's just self-adherent tape that you can order from some medical supply locations, and sometimes they'll have it in local pharmacies as well. It's useful to just give it an extra layer of protection around everything, and you don't want to wrap it too tight because you want circulation to the extremities and wherever it might be that you're wrapping. And this is useful, as I said, to keep it clean, dry, and intact, and it comes in some great colors for kids. So here are some of the moisturizing creams that I would recommend using once the scar has gotten to the point of healing. So the wound has started to heal up, you're not seeing any more discharge, it's pretty much just getting to like that dry, scabby look on the skin. You can start using this. I mean, you still want to follow your doctor's recommendations and keep it evaluated before using all of these creams, ointments, and dressings. You want to make sure that you're doing it at the right time and on the right stage of your healing process. But here are, of course, the Eucerin, Aquaphor, and cocoa butter for those that really like that as well. I would recommend it for this area just to keep the skin nice and moist, and it actually can help regain some pigmentation by keeping that skin protected and moist. And moisturized. So the biggest thing it actually prevents is this hypertrophic scarring, which is that raised bumpy scar that just is the hardest to get rid of once it's there. But if you're in that last stage of healing, and then those last 12 to 18 months, you really want to just make sure that the skin gets as much moisture as possible. And I've listed some other possible lotions that are really good for this. You do not want to use any perfumed lotions or, I put it, made the scented lotions on these areas because they can actually cause more irritation to the skin. So you want things that are advanced therapy, moisturizing creams, no fragrance, to kind of help out in those areas. And you want something that's not too thick, especially on the face, to kind of reduce any other type of irritation to the pores. So let's talk about applying that lotion. There's a few different, just more specific ways of just massaging that lotion into the skin to help that scar just reduce the formation and get it really in there. So you want to crisscross massage by pulling and pushing the fingers along the length of the scar. You're going to go up, down, left, right. And then you want to do some circles around it and inside of it. And each area you want to keep massaging for like 3 to 5 minutes, at least 3 times a day, for that time period that you're using the massage and the lotion. And you want enough pressure that when you press down, that skin color turns white, and then it'll come back, of course, to the regular color, but you just want enough pressure. Now, you don't want to be forcing it down, but just enough to change that skin color, so you know that it's really getting into the skin. And if it's in the palm of the hand or base of the foot, you want to try to do the star pattern so you get in the little crevices of the hand in those joints. So you've tried all these ointments, you've gone through the moisturizing, you've done all that your doctor's told you to do, and you still have a nasty looking scar. Sadly, sometimes this happens. And there are ways to treat it still. So there are surgical and laser interventions that we're going to talk about. So here's some more of our options. We have skin grafting, which is the placement of skin from another part of the body or from a donor that is used to replace the skin. So it's kind of stitched over top of where the skin was and it adheres to it. It's a little more tricky, but it is available as a possibility to kind of help the body heal a little better if it's not able to heal on its own and recreate that skin area. This is usually for really, really deep thickness wounds and deep thickness burns. There's surgical excision, which is removing that scar tissue completely off and allowing the body to re-heal and create another skin layer. Or after excision, sometimes you go back to the skin grafting and put skin from another part of the body, a thin layer of it over top of where you have taken out the scar. Now, laser surgery is this really neat newer device that actually uses thermal injury. So it heats up that scar area and creates a new injury that allows in-depth, like deep in the skin, re-healing of the damaged tissue and allows your body to naturally remodel it. And sometimes they use the laser there also to help with that remodeling to make it even closer to the natural skin color and texture. And then there's the laser assisted delivery of medications, which can also help with that healing process. And you can just put that medication and ointment in deeper with the lasers. And it's usually used for like corticosteroids to increase the healing process and decrease the time of healing. Here's a little bit more about the laser therapy, especially ablative fractional resurfacing, which is a type of laser therapy that has gained popularity in the cosmetic improvement of skin conditions such as acne, surgical, and burn scars. Can be used for scars that have not only even impaired appearance, but have also disabled the use of the extremities. So those contractors not being able to really move the joints around because of the scar tissue just makes it too stiff. The principle of the treatment relies on the laser mediated production of precise thermal injury to depths not routinely attainable by other devices. In effect, the laser re-injures the tissue to induce the body to heal, and can typically start within 2 to 5 months after the injury. You can start trying to use this to reduce the remnants of the scar. Now, with laser therapy, it does take several treatments. So here are pictures of a child who had a very deep partial thickness scald injury to her scalp and posterior neck. So back of her neck and back of her head. And she underwent an excision and had an allograft, which is one of the types of skin grafts. But it still left this nice large mark in the back of her head. So she went through the laser therapy, and you see after several treatments, it starts to really look like her natural skin again. So let's just take another second or so to review what we've talked about. So we know there are many ways to get scars. It's a natural part of the body's healing process. It is not something that just happens to one person. Everyone that has any type of cut or injury is likely to have some type of scarring. They can be treated, and we do have ways to prevent getting injured and to prevent the scarring if we're able to treat it properly. And then we've discussed a lot of the dressings for wounds, including our silver-infused ointments and dressings, our antibacterial ointments, and our wraps. We always want to make sure to keep that skin nice and moist once it gets to that point of drying out and has healed over. Let the body do its course of healing, and its different stages of healing is when we use our different types of treatment. If we want to have proper care, can actually help reduce the need for any of those interventions. So we want to try to do all of these interventions before we get to the point of having to use a surgical laser. But you really want to make sure you talk to your provider, not only if you have any questions about these treatments procedure, but if for any reason that you're concerned about a wound. So if you have any impairment in the movement of a joint because of a scar tissue or because of a wound, you want to have it checked out. Blistering definitely shows that it's a deep injury, and you want to get that reviewed, especially on your children. They can't always tell you, or they push through a lot of pain. It's hard to tell, especially on infants, what their problem is and what's going on with them. So you want to have them checked out if you can. And you can always come to the burn clinics that are specific to burns and other types of wounds. I would like to thank Johns Hopkins Children's Center for a lot of the instructions that I've used today, as well as these studies on the efficacy of laser therapy. They did wonders to help me with not only picture presentations, but for the descriptions of the different treatments. The images that I used for the different types of treatment, for the different ointments and coverings and lotions, those are all from these different medical supply websites, which you can actually purchase them from. So hopefully they're like a little advertisement, and it helps you to find places that you can get these things if they're recommended for the treatment of your scar and your wound. Thank you for watching, and I hope you have a wonderful day.